This is a case study of a patient who requires hump reduction, tip defining, and tip rotation. And in addition, it's a complicated case in that she has fairly thick skin, so there's some very specific techniques that are required to achieve this. So on the front view, what we're going to try and do is narrow a fairly boxy tip and also tilt it up. I think on the front view you don't really see much of a hump, so we'll show you that on the side view. On the side view, what you can see is that her bridge is a little bit too high, and also the tip of her nose could probably come up or tilt up a little bit. So in terms of the hump reduction, again, like we've done before, taking down some of the cartilage and bone that are forming the hump achieves the hump reduction. So that's simply removed, and then because it develops a bit of a flattening, we'll often do osteotomies on the sides to narrow the nose bones. So that's been done. Now, with her nasal tip, I think you have to think about this case a little bit different perhaps than some of the others. Her skin is quite thick, and so the changes that we want to make underneath are going to have to be fairly dramatic in order for us to see them. Otherwise, the skin will camouflage, just minor changes. So in her case, the first thing I did was a cephalic trim. So we remove the back end or the cephalic end of the tip cartilages to make them narrower. Now, in addition to that, we also want that narrowed cartilage to have a better or sharper angle. Now in her case, because her cartilages were fairly bulbous and strong, and she also had thick skin, I decided to use a technique called dome division. And dome division means that I actually make a cut through the dome cartilage and separate the two ends completely. And that allows them to lose all of their intrinsic spring, and it makes it possible for me to angle them in quite dramatically. Now that cut could be seen through the skin in someone with thin skin. In someone with thick skin, it's not seen. So it's very appropriate for someone with thicker skin, not appropriate for someone with thin skin. So that allows me to reposition the cartilages and then secure them in place again with stitches. And that takes us from a broad and boxy shape to her nasal tip to a much more narrow and defined shape. Again, keeping in mind that the overlying skin is fairly thick and does to a certain extent camouflage some of those changes. So once that's all been done, the other thing I did for her was I narrowed her tip and rotated it through the use of what are called cephalic margin stitches. So in her case, I pulled each of the individual cartilages up and in by suturing the cephalic edge, the part that had already been cut, to the underlying cartilages above. So that narrows and rotates her tip, so that you get two benefits from that technique. So this is her before and after, and you can see the hump has been reduced. The position of her tip has been elevated and narrowed. And on front view, you'll see that the broadness of her tip has been substantially decreased so that she's got a much more narrow tip, and also the tip has been tilted in an upward direction as well. And this is her 3/4 view again, tip rotated up slightly and defined. And in someone with fairly thick skin, I think this is actually a very good result.